Lisa Goins, nurse practitioner with Couture Healthcare, and we were talking about vital signs, and we were covering blood pressure, pulse, temperature, saturations, and cell phone courtesy. But the other thing that we would like to mention to help make sure your vital signs are accurate is smoking. Now, smoking is a habit-forming thing, and some of us have been doing it for a long time, and some of us don't do it, and some of us are trying to quit, and it does take a while to quit. There are several things on the market that we can prescribe to help you quit if you're looking at what's called quitting smoking or smoking cessation. But one of the reasons that we need to know when you had your last cigarette is, unfortunately, it will make the blood pressure change. It may not be accurate. A lot of times, a person who just smokes and they come in, it will affect a temperature as far as putting it in your mouth. And the same thing as if you're drinking any kind of fluids, hot or cold, that can change the temperature in your mouth. So we may not get an accurate reading. And then your blood pressure may not be accurate. It will be a little bit higher. So if you are going to come in and we're going to do vital signs, you have an appointment, try to not smoke at least an hour before you come and see us. The reason why is if we keep getting these high readings, we don't really have a real accurate reading, okay? Now, another thing with blood pressures is, when you first come and see me, there's also a thing called the white coat syndrome. And a lot of people will see the white coat and their blood pressure will go up. So there's white coat syndrome. But back to the smoking, we want to talk about holding off best you can, and that way your blood pressure will be a little bit more accurate. Now, your provider may also want to know just how bad the smoking is elevating your blood pressure. So do let the provider know if you've been smoking or not, and they can look at your numbers and say, you know, this is really bad on your heart, and here's the numbers. And over a series of visits, you're going to be able to have a nice tracking pattern of smoking and non-smoking and the difference in bringing your blood pressure down. So I'm Dr. Lisa Goins, nurse practitioner, and we were talking about smoking cessation or quitting smoking and affecting with the blood pressure.